We're going to aspirate, and then we're going to do our 10 cc flush.
They have no pulse, and they have no respirations going on.
Oh my goodness, Alex.
I felt the empathy and I felt the calmness, which was for a patient, is huge.
Someone's doing compressions, we get someone
The L.E.A.R.N program actually began with redesigning clinical education across all of Advocate Healthcare so that we have a systematic, standardized approach to education and to learning across the system.
So no matter where a patient touches Advocate, they get the same care.
Central lines, blood transfusion.
The Advocate L.E.A.R.N program is a combination of a general orientation program, beginning competency assessment, as well as an immersive training program.
L.E.A.R.N offers you the ability to do hands-on work, which is really, really helpful.
We're gonna get you some help.
We actually simulate real-life scenarios that nurses might encounter in a clinical environment.
Sometimes this dressing will start to pull away, okay? And what does
By
that
incorporating
cause?
simulation into an experiential type of model, we're really making sure that we're offering the most robust and innovative orientation experience for our new associates.
And when you think about the fact that we're caring for patients, real-life human beings, I think it's really important and will be an asset overall as we build the quality of nursing throughout Advocate Healthcare.
So today we're going to learn about some of the techniques that we use here at Advocate in regards to our
The focus is on building a standard foundation for the advocate nurse with an emphasis on patient safety.
One of Advocate's primary initiatives is patient safety, and the Advocate L.E.A.R.N program provides us the opportunity to apply what they've learned in their orientation program and for us to be able to identify any future developmental needs that they may have prior to them moving forth into the clinical unit.
So when you're on the unit, you have that confidence where you know this is the latest evidence-based practice.
So what happened here? Is the electrical system working with the mechanical? No.
The typical training for L.E.A.R.N actually consists of 4 days over the first week of new associate orientation.
We have a maximum number of learners at 30. So instead of having large groups where we're showing lots of PowerPoints and having lots of, talking at them, they're really getting in there and being able to have their hands on equipment, being able to apply the things that they are learning. So it really allows for an immersive environment.
So the blend of classroom time with hands-on application really helps to prepare them for situations that they're going to see with real patients.
So if you look right here, we want to get to the Advocate homepage. So
Each day begins with portions of electronic medical record training and skills station. Some of our skill stations may be operating IV pumps or looking at addressing central lines, going through a mock code and being able to utilize some of the equipment. And then we progress to afternoon sessions where we're actually able to analyze how do they apply those skills in a simulated environment utilizing standardized patients.
That's really where the learning happens. We're able to talk about what went well, what didn't, some of the things that we may do differently next time.
We're constantly doing an assessment of an associate's needs during that 4-day orientation period, but that does not end during that 4-day period. When the associate transitions to the unit, we actually have educators that are partnering with the clinical coaches as well as our unit leadership to make sure that that new associate is getting everything that they need.
It gives you that confidence where you know someone is still looking after you until you know you're doing it right.
we're going to have 4 skill stations this morning.
In developing the Advocate L.E.A.R.N program, we benchmarked with many other organizations to find out what were the best practices and settled on that Jumpstart model from Ohio Health. We took that model and modified it to ensure that the nurses that come out of our orientation program are the advocate nurse that we want them to be.
But what kinds of other things would you maybe put in place for a patient like Alex that may prevent a fall?
We're hearing that their interactions with the patients are much better, that they're much more prepared to be off of orientation, and that they're ready to be on the units and to provide that safe patient care that we're looking for.
I think you guys from word go communicated so well with me.
It's very important as an organization that we do everything we can to assess that we have nurses that are able to provide this high level of safe patient care. L.E.A.R.N affords us the ability to be able to do that.
So I'm really excited to be able to prepare nurses in this way, knowing that when they walk out of our doors in the learning environment, that they are ready to join our workforce.
And welcome to Advocate. Great job. You did a really good job.
Very professional, very
Yes.
professional presentation.
I am an advocate nurse.
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 I am an advocate nurse.